The combined oral contraceptive pill. This is the most widely used hormonal birth control method in the world, commonly known simply as the pill. It contains two synthetic hormones, estrogen and progestogen, which work together to prevent pregnancy through three mechanisms. First, they suppress ovulation so that no egg is released. Second, they thicken the cervical mucus, making it difficult for sperm to travel through. Third, they thin the uterine lining so that even in the unlikely event of fertilization, implantation becomes far less likely. The pill is taken daily for 21 days, followed by a 7-day break, or continuously depending on the formulation. When taken correctly and consistently, it is over 99% effective. However, effectiveness drops significantly with missed doses, interactions with certain medications, and gastrointestinal illness that prevents proper absorption. It is not suitable for women who smoke and are over 35, or women with a history of blood clots, migraines with aura, or certain cardiovascular conditions. The progestogen-only pill, often called the mini pill, this option contains only progestogen and none of the estrogen found in the combined pill. It works primarily by thickening cervical mucus and, in some formulations, by suppressing ovulation as well. Because it does not contain estrogen, it is considered suitable for women who cannot take estrogen for medical reasons, including those who are breastfeeding, have a history of migraines with aura, or are at higher risk of blood clots. The timing requirement for the mini pill is more strict than the combined pill. Depending on the specific formulation, it must be taken within a 3 or 12-hour window each day to maintain effectiveness. It is equally effective to the combined pill when used correctly, but leaves less room for inconsistency in daily timing. The hormonal IUD, an intrauterine device or IUD, is a small T-shaped device inserted into the uterus by a healthcare provider under local anesthetic. It releases a low dose of progestogen locally into the uterine environment. This thickens cervical mucus, thins the uterine lining, and in some women partially suppresses ovulation. Because the hormone is released locally rather than systemically, the overall hormone exposure is significantly lower than with a daily pill. Hormonal IUDs are among the most effective contraceptive methods available, with a failure rate of less than 1% per year. Depending on the brand and dosage, they last between 3 and 8 years, but can be removed at any point if pregnancy is desired or the method is no longer wanted. Many women experience significantly lighter periods or no periods at all while using a hormonal IUD, which is an additional benefit for those with heavy or painful menstruation. The copper IUD. This is the non-hormonal version of the intrauterine device, and it works in a completely different way. Copper is naturally toxic to sperm. The copper ions released by the device impair sperm motility and viability, preventing fertilization. The copper IUD contains no hormones whatsoever, making it the most effective non-hormonal contraceptive method available, and a strong option for women who want to avoid hormonal influence entirely. It is over 99% effective and can last up to 10 years. It can also be inserted within 5 days of unprotected sex and used as emergency contraception, making it the most effective emergency option available. The main drawbacks are that periods may become heavier and more painful, particularly in the first few months after insertion, which makes it less suitable for women who already experience difficult menstruation. The contraceptive implant. This is a small, thin, flexible rod roughly the size of a matchstick that is inserted under the skin of the upper arm by a trained healthcare provider under local anesthetic. It releases a steady, low dose of progestogen continuously into the bloodstream, suppressing ovulation and thickening cervical mucus. The implant is one of the most effective methods available, with a failure rate of less than 1%, and it lasts for up to 3 years before needing to be replaced. Once inserted, it requires no daily action or attention. The most commonly reported side effect is irregular or unpredictable bleeding, particularly in the first few months. For some women, bleeding becomes very light or stops entirely, while for others it becomes more frequent and irregular, which is the primary reason women choose to have it removed before the 3-year period is complete. The contraceptive injection. This method involves a progesterone progestogen injection administered by a healthcare provider, typically into the arm or buttock every 8 to 13 weeks, depending on the formulation used. It works by suppressing ovulation and thickening cervical mucus. It is highly effective when injections are received on schedule, with a failure rate under 1% under typical use. A key consideration specific to this method is the delay in return to fertility after stopping. For most women, it takes several months for the hormonal effects to wear off and ovulatory cycles to resume, and in some cases, it can take up to a year or longer, which makes it less suitable for women who may want to conceive in the near future. It is also the only reversible contraceptive method where the effect cannot be immediately undone once the injection is given. The male condom. This is the only contraceptive method that simultaneously protects against both pregnancy and sexually transmitted infections, which makes it fundamentally different from every other method in this list. It works as a physical barrier, preventing sperm from reaching the egg entirely. When used correctly and consistently, it is 98% effective. In typical use, accounting for inconsistent or incorrect use, the effectiveness drops to around 85%. Condoms require no prescription, no hormones, and no medical procedure, making them the most accessible contraceptive method available. They are the only method that actively reduces the transmission risk of infections, including HIV, chlamydia, gonorrhea, and herpes, which no hormonal method offers any protection against. Emergency contraception. Emergency contraception is not a regular birth control method, but a backup option used after unprotected sex or contraceptive failure. There are two main types. The hormonal emergency pill, commonly known as the morning after pill, works primarily by delaying or preventing ovulation. It is most effective when taken as soon as possible after unprotected sex and is generally recommended within 72 hours, though some formulations are licensed for use up to 120 hours. It does not terminate an existing pregnancy. The copper IUD can also be used as emergency contraception within 5 days and is the most effective emergency option available. Emergency contraception is a safety net, not a primary strategy, and understanding the regular methods reduces the need for it significantly.